Where the hell is Dr. Baxter? We've been waiting all this time.
I don't know. Late as usual.
Oh shit, sorry guys.
Where have you been, Dr. Baxter?
Oh, just sort of around, you know. Anyway, let's start.
We're just in time for our article of the week.
Oh, article of the week. So this study aimed to research variations in progesterone, estradiol and relaxin plasma concentrations when administering Algepristone alone and in combination with cloprostinol to terminate a pregnancy midterm in bitches. So it was conducted to provide clarity on the mechanisms of abortion for different protocols for pregnancy termination, specifically focusing on endocrinological changes. Some of the previous studies found that the AGL and misoprostol used together were more effective and that abortion was achieved within 6 days of administration. But combinations of AGL with oxytocin and then AGL in combination with PGF2 alpha found to produce a greater contractile response in both circular and longitudinal muscle fibers, which is pretty cool. So it didn't really fill a gap in the knowledge from what I could read, but it expanded on some of the previous studies, and there's a few similar written around the same time. And the only difference was that it measured the samples at 6-hour intervals to provide a bit more clarity. And I couldn't find a hypothesis in the first part.
Okay, so I took a squiz at the study design and I found that the interventions used were 2 different treatment protocols. So one being Algepristone all on its own and the other being an Algepristone-Cloprostinol combination. So Algepristone is a antiprogestin with a really high affinity for P4 receptors, whereas cloprostinol is a prostaglandin, so it stimulates contractility of the uterus and the smooth muscle. So upon use of the interventions, serum progesterone, estradiol and relaxin concentrations were measured, and this was done by taking blood samples immediately before initiation of the treatment and every 6 hours thereafter until abortion was complete. These blood samples were stored at -18°C until hormone analysis was carried out. So the study used a total of 14 healthy pregnant bitches from different breeds between days 25 and 32 of gestation. So these bitches were split into 2 separate groups, 7 in each group, 1 group for each of the protocols. So the protocols, Algepristone and the Algepristone-Cloprostinol combination, they were administered subcutaneously, once daily on 2 consecutive days.
Well, let's have a little look at the results, and they seem pretty clear. From a clinical sense, there wasn't really a significant change in the time for abortion between the Algepristone group and the Algepristone-Cloprostinol treatment. But there was a significantly high incidence of vomiting in the Algepristone-Cloprostinol group to the Algepristone alone treatment. Additionally, there was some diarrhea documented in the Algepristone-Cloprostinol group, but it was not to a significant amount, so I guess I'll have to do further study to see if that's a side effect. But from a hormonal perspective, there was a significant difference between the groups. So the progesterone serum concentration was significantly lower in the Algepristone-Cloprostinol group for almost the full duration of the administration. And it was seen that there was an effect size, a difference of approximately 6 standard deviations at the start of abortion and 3.4 standard deviations at the end of abortion. So you can see that it's quite a pronounced difference. The estradiol concentrations were also seen to be significantly lower in the Algepristone-Cloprostinol group at 4 of the 18 serum collection intervals. Although this was not the same magnitude as the progesterone discrepancy. Relaxin was the other way, I guess. It was seen to be significantly higher in the Algepristone-Cloprostinol group in 5 of the 18 serum collection intervals. So there is quite a difference in the hormonal levels of the 2 groups. Unfortunately though, for the relaxin and the estradiol concentrations. No effect size could be determined from the data given in the paper. Also, it seemed that the sample size used for the experiment was quite small. As you said, there was only 14 dogs, 7 in each group. So any sort of confounding factors that may have affected the results, such as the breed of the dogs or anything else, could have had quite an effect on this experiment.
So after I had a quick look at the study, I thought that the results did not really replace any knowledge, but further validated what was found in previous studies. It does, however, clarify some uncertainties that arose when I was reading previous work. For example, it was mentioned in the Journal of Reproduction and Fertility that fetal expulsion occurs after the use of algepristone, but it was left unanswered as to what hormonal changes are driving this. The current study concluded that the fetal expulsion occurs due to the elevated levels of progesterone and estradiol associated with the use of algepristone. The termination of an unwanted pregnancy in bitches is one of the most common requests from dog owners, particularly breeders. As a vet, it's important for us to be able to choose the most efficacious drug with minimal side effects. To do this, I think it's helpful to have an understanding of the hormonal changes that occur during the use of these drugs, thus making this study of relevance. Of particular importance was the Algepristone-Cloprostinol combination did not significantly shorten the time between treatment administration and abortion. And this is important because the cloprostinol is also associated with more side effects like diarrhea and vomiting and depression. So there's not really much point in using the combination because these side effects might happen. New knowledge was found about the relaxin concentrations that occur. So it was found that relaxin was high in the Algepristone-Cloprostinol group, suggesting that these changes are due to the effect of cloprostinol on the fetal placenta. And this indicates different effects on the placenta than was previously thought. But how that's really of clinical importance to vets is unclear at this stage.
So that's done, huh? Oh, I gotta go back to vet things.
See you guys next week. Sorry, I'm really gassed.